Over the course of about 200,000 years, mankind has dealt with several epidemics and pandemics. One of the reasons why epidemics and pandemics happen is the domestication of animals. Due to the onset of the agricultural revolution, living in proximity with domesticated animals has favored the spread of infectious diseases from such animals to humans. Epidemics and pandemics differ on the sense of scale. Epidemics are localized and thus happen in a single community or country, whereas pandemics are of a global scale. Such incidences are quite frightening, especially because some pandemics, such as the Black Plague, 1918 Spanish flu, and HIV/AIDS, had very high mortality rates. We are currently experiencing a pandemic. However, I think that there are other things we should be worried about. The coronavirus disease 2019, which was first identified in Wuhan, Hubei province, China, is caused by the severe acute respiratory syndrome coronavirus. Symptoms exhibited by those who are infected include cough, fever, and shortness of breath. As of March 4, 2020, there are 94,328 cases. 3,222 of those cases have resulted to deaths, and 51,317 of those cases have made full recoveries. Those numbers may seem a bit scary right now, but there are quite a few reasons why such numbers shouldn't get enough for us to think that COVID-19 is a death sentence. Generally, COVID-19's fatality rate is higher for those who are aged 70 years and older. There have been no recorded deaths for those who are younger than 9 years old. Deaths attributed to said disease are also due to arising complications from pre-existing conditions such as cardiovascular diseases, chronic respiratory diseases, and diabetes. Authorities also speculate the global case fatality rate to be lower because there are undocumented cases. Therefore, COVID-19's fatality rate is highly dependent on the person's age and medical history. This entails that people who get infected who have strong immune systems have a very high chance of making a full recovery without permanent or long-term damages. In the Philippines, the Department of Health has probed 662 patients and has confirmed only 3 cases. Out of those 3 cases, 1 death was recorded while the other 2 have recovered. If compared to other countries that have recently recorded infections, our records pale in comparison. This is because other countries have ample test kit supplies and thus have been able to begin rapid testing immediately. I think that more than anything, this epidemic exposes flaws in our government and healthcare system. When the news of the first coronavirus case in the Philippines was released, there was rampant panic as we saw in the general behavior of the public. Supplies of surgical masks ran out in a few hours. There were lots of fake news articles which turned up in social media platforms, and numerous people became victims of such posts. Actions from the government and local healthcare organizations were slow and sparse during the first few days of the infection. The low number of COVID-19 cases in our country may give us a fake sense of relief and lure us into thinking that our country is one of the safest places to be in at this time. However, these records only reflect how ill-equipped our country is at times like this. If we take into account the state of public transportation, the massive budget cuts the healthcare sector received, and the lack of manpower in healthcare institutions, it's hardly plausible that there are only 3 cases of COVID-19 in our country. There might as well be hundreds and thousands of cases going by undetected, and we can't exclude the possibility of cases not being announced in order to prevent panic. Relatively speaking, COVID-19 has lower death rates than past pandemics such as H1N1 and MERS. Our current situation only proves that it is not actually the infectious disease itself that is scary, but instead it is the incompetence of the government, the faulty healthcare system, and the lack of well-informed citizens that are actually alarming.